it was quite confronting. So he was a fetal alcohol baby, and he was living with a carer that also cared for 3 other children. And he was losing weight since birth, failing to thrive with mouth ulcers and oral yeast infections, nappy rash. And when I encountered him, he was pretty tired and irritable, not really interested in playing like the other kids. And he'd been like that for some months. And it really just highlighted to me the way that the whole team needs to work together, regardless of conflicting opinions on individual cases, to achieve the best outcome for the child, even though that might take some time. But yeah, happily he was brought into Cairns for some treatment. So 4 huge issues in kids' health that I saw while I was up there, because I would say most of the patients that I saw were kids. Scabies, skin sores, ear infections, and rheumatic heart disease. They're all huge issues. Like a large proportion of kids would come in with sores which get infected, and I'm just going to go into that a little bit. So this is a bicillin injection that's given to children at risk of heart disease due to infections and skin sores. And it's a pretty painful one. You give it over 2 minutes, and it's really thick, and it's quite difficult to convince them to let you give the injection every month. And it's to prevent heart disease as a result of skin infections. And Australia has one of the highest rates of rheumatic heart disease due to skin infections, and it's because of the prevalence in our Indigenous populations. So it's quite confronting to see these sorts of stats that we have in Australia because of the health of our Indigenous people, and this is just one of them. This is another photo of me with a lovely little baby, and she had an ear infection. And a little bit more on ear infections. So runny noses and respiratory infections cause a lot of trouble in Indigenous communities, and the kids have really bad ear health, and the deafness that results really impedes their learning and performance at school, and it has a huge impact on the child's future. And there's a lot of literature on this, looking at the outcomes as a result of this, and yeah, it's just another one of the huge issues that I observed while I was on placement. So some of the other clinical experiences that I was lucky enough to have, I did some suturing and taking blood and giving injections and doing dressings. And while the doctors were there in the clinic, I sat in with them on their consults, managing chronic disease patients, which was very interesting, and seeing how they talk to the specialists in Cairns and manage the patient's care long term. And then I also did a bit of going out into the community and collecting and dropping off patients and seeing the living conditions, which was very interesting and very confronting at times. Yeah, I wanted to, going into this placement, see what it was really like in an Indigenous community, and I feel like I got a very good experience of that. It was confronting the first day I got there, getting picked up from the airport, which was just a shed, and then taken back to the flat next to the clinic with really high fences and duress alarms in each of the rooms, and sort of thought, oh, I wonder what's going to happen if I need to use one of those. But it was a very peaceful community, and I got along very well with everybody that I met there. And the staff were, they went above and beyond to make sure that I got as much out of it as possible, and had some really great practical experiences. So got nothing but good things to say about the place, really, and I really hope that I can go back again as soon as possible. So these are some photos I took around while I was exploring. This is near the old site where the mission was originally, and that's a river nearby, and you can see the crucifix in the middle of the river. And this is a horse on the left. There's wild horses all over the town, and they just kind of walk through the streets and do their own thing. On the top right is the school, and the bottom is the shop. Yep. And that's one of the roads. And that was the beautiful Lockhardt beach. It was very pretty. Yep, and that's the airport, the day I left. So, yeah, I just want to say a huge thank you to the club for giving me this opportunity. And it's been great to share the experience with you. I hope you found it interesting. So, thank you very much.